was leaving my friends with a friend, getting a cab on 116th and 2nd, and they had the street closed off, and I got in the middle of the street and I fell into a pothole. And when I fell into that pothole while trying to get into a cab, I fell down, and you know how sometimes you know that stuff that's just happened or it's bad? This was bad. I could feel my arm, just body, everything just go totally into shock. The pain was excruciating. They took x-rays, they took a look at it, and they realized that what had happened was that I had what they call a Monteggia fracture, which is a fracture at the tip of the elbow, a dislocation of the ulna, and a break in the ulna, which is the part that rotates. So in any case, they talked about what to do. They said that now the arm was way too swollen to operate, but eventually they decided to bring down an orthopedist, and he says, well, you know, I'm looking at your x-rays. You definitely need plates and screws, and you definitely need surgery, and you need to do it soon, within a week to 10 days at the latest. And about the only thing they're really guaranteeing me after they have the operation is I'll never have full extension of this arm again. So that's not really very comforting to me. So reaching out to the community that does integrative health seemed to be the right approach. I was familiar with it, I was ready to embrace it, and if they were ready to feel that they could work with my injury and get results, I was ready to go with that. And that's what I did, and I'm very glad that I did.
We need to be pragmatic until we see evidence, we see results. And what we're doing is we're doing research that is generating evidence.
Basically, I'd put out my arm, I'd sit in a comfortable position, and I would actually feel some things going on in my arm and in my body that I was not that familiar with. And then afterwards, I'd be able to have more extension, less pain than I had just before. I was on one particular moment, there was a bone that stuck way out, and during that session, I was actually able to see and feel that bone slightly moving back into the position. I know that sounds kind of remarkable, but that's what happened.
But there are deeper changes at the level of the tissues as well, so that changes in the soft tissues as well as bony tissue can ensue.
Then I decided that I'd continue to see a surgeon. I decided to pick a surgeon at Hospital for Special Surgery. He went to see me, he took a look at it, he took x-rays, and now we're talking about a month and a half after the original injury. I've got full extension, I got full rotation. He took a look at the x-rays, and he took a look at my arm, and he said, really, your recovery is nothing less than remarkable. Absolutely, positively nothing less than remarkable. But really, as you can see, my arm is in really pretty good condition. I know that it sounds totally wacky that you can have a positive approach in just a few weeks without using plates and screws and traditional medicine. But this is exactly what's happened here. I'm very grateful for it to JP and that whole team. Without him, I would still be not able to do anything with this arm today.